They are the simple pleasures that Ginny Dudek enjoys most, like walking outside and planting in her garden. Dudek, who suffers from Lyme disease, enduring years of bouncing from doctor to doctor in search of the most effective treatment.
I had an enlarged heart, I had heart block. All of those things have been resolved. I'm healthier at 67 than I was at 50. Definitely.
Because of this doctor?
Because of this doctor.
We're choosing not to name Dudek's doctor because she's currently being evaluated by the North Carolina Physicians Health Program, or NCPHP. It's a nonprofit organization whose self-described mission is to assist with recovery from substance abuse disorders and other conditions that could impair a provider's ability to safely provide care. Dudek's doctor, she still has her medical license, but the doctor telling ABC11 she's being strongly advised to avoid treating patients during the evaluation process, and she's choosing to heed that warning. The doctor also saying the NCPHP assessors are accusing her of being an alcoholic and putting herself in dangerous situations. The I-Team could not verify those claims because PHP records are confidential.
Never once was there an indication that she wasn't really sharp.
Do you feel like you're being protected here?
No, I'm being denied the medical care that I need.
The medical board is one of several entities that financially support the PHP and rely on its work. Doctors, pharmacists, and veterinarians are generally referred to the PHP, which can then send referrals for further evaluations, send them to treatment centers, or recommend monitoring. Whatever is recommended by the PHP is generally not covered by insurance, so people like Dudek's doctor can be forced to shell out thousands of dollars of their own money for treatment. Dr. Jesse Kavanaugh, a former Duke professor and chief medical review officer for the U.S. Army, telling the I-Team he's working with dozens of physicians he says are trapped in the PHP's process, but don't have any psychological, drug, or alcohol problems.
Well, I think it's very unethical. I think it's extremely unethical to make a diagnosis when the person doesn't meet the required diagnostic criteria. Don't get me wrong, there are doctors who deserve to lose their license. There are. I want to see it change. I want to see the situation change.
Kavanaugh's concerns leading to a major investigation of the PHP in 2014. The key findings: no indications of abuse by the program and no evidence of financial impropriety. But the program lacking objective due process and creating an undue burden on physicians by requiring them to use out-of-state treatment centers. Some centers also were found to sponsor PHP staff retreats. State officials making several recommendations for improvement and corrective actions, and a follow-up audit released just this year, finding those recommendations are being followed. The I-Team requesting to speak with the PHP about the audit and Ginny Dudek's concerns, but the CEO choosing not to talk on camera. Instead, he says in a statement, "We ask patients to understand that NCPHP and the NC Medical Board each have an obligation to ensure that medical professionals are safe to practice. NCPHP has a very strong track record of making the right call. The bottom line is that there is just no evidence that NCPHP has ever made a referral without sufficient cause, and in fact, there is compelling evidence that NCPHP's judgment is incredibly sound when making referrals." So Ginny Dudek's doctor right now is kind of in a holding pattern. The PHP is recommending a 28-day program, but the doctor is trying to fight that. That means Ginny is also in a holding pattern. And Joel, she may just have to look for prescriptions elsewhere, and she says that may be online.